Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. So today I wanted to talk about two interventions that could happen during your birth and what they are and why you shouldn't always fear them. So there's a lot of movies out there that are slated at the more like scaring you, childbirth propaganda type of thing. But I want to talk about an IFM, which is Internal Fetal Monitoring, and I want to talk about an IUPC, which is the Intrauterine Pressure Catheter. So, in order for either of these to be done, first of all, we're going to go through brain, okay? So the benefits of them is that one, for the interpressure uterine catheter, it's like a long, kind of flexible, wiggly stick, straw kind of looking thing. Then it goes between the uterus and the baby. The benefit is that from that reading, you can get a very accurate, by doing a mathematical equation, again, that's why we love doctors and I don't have to do it, it gives you a really good reading on actually how strong your contractions actually are. Even if you're contracting every 2 to 3 minutes, sometimes the uterus just isn't doing it strong enough to make cervical change. So that's when Pitocin might want to be added or upped. But this gives them, instead of saying, well, let's troubleshoot and just like do it, this gives them a very accurate measurement that says like, okay, yeah, we literally know now that you're having okay contractions, but if we add the Pitocin, we can like really get it going, get some cervical change, and have a baby, okay? So that is, but that also needs to be done. The risks of it is that it has to be done when your water's broken. So you are susceptible a little bit more to, different bacteria being introduced. Possibility of an infection could form. It's a low risk, but sometimes the benefits are going to outweigh the risks, okay? There aren't really alternatives to it. It is what it is. The monitor that is on your belly is telling you you're having a contraction. It just doesn't tell you how strong it actually is, where with an interpressure uterine catheter, you literally know how strong it is and what they need to do to get it to make cervical change. Benefit to it, I would say too, on the golden side, is that you can take that monitor off your belly and you can be upright. And so if you're not doing if the body is not tracing very well, using the monitors, it's just a really good alternative sometimes. It also can give the doctors a much better picture of what's actually happening versus just saying like, oh, it's not working, let's go to C-section. It can be like, okay, well, this is kind of where we're at right now. Let's see what's happening. The other one, the IFM, the internal fetal monitoring, is also done when the water's broke. Usually these two things go hand in hand. That's why I'm talking about them together. But again, you get to remove a strap because there is a little... it looks like the end of like a notebook ring, but like way smaller, way thinner, and just like goes right on the top of the baby's head. If they have a lot of hair, sometimes it'll slip out and has to be put back in. But it gives them a very accurate picture of the heartbeat. And so if tracing's not going well, again, if you're only tracing well if you lay flat on your back, of course that's not where you want to have your contractions, right? And so this is a great alternative because now it's being transmitted wirelessly, and you can be up and moving about with either of these. You don't have to remain in bed with them. It gives them a much better accurate picture of what's happening, but they are invasive because they're being inserted when your water is broken. But again, it is a benefit if you want that better picture to know like where you're going with this labor and where it needs to go. Okay, so generally this is only going to be used if they just need to get a better picture of what's happening, or the baby's just not tracing right, and instead of just saying, oh, it's not working, to be able to get an accurate picture of this baby's heartbeat, let's put in a scalpel so we can get a much better idea of what's happening, and just kind of gives everybody a, okay, is this baby doing as well as it looks like it is, or is it not doing as well? Is it doing better? You kind of get what I'm saying. So the goal of us as doulas is to be able to navigate all these options. That's what we talk about in our class for childbirth education. I leave no stone unturned. I want you guys to know all about them because it's about patient experience. When you know about it and you know that this could possibly be something that you experience, instead of being like, well, I don't know about that. I'm scared. I've never thought about it. I didn't learn about it. You're like, okay, I know about it. I know the benefits. I know the risks. I know the alternatives. And let's see what my intuition's telling me. What if we didn't do it? What will be next? And that's a conversation for you and your medical provider. So that's why I want to talk about this. So again, it's the IFM, the Internal Fetal Monitoring, which is the little scalpel that gets put in, or the IUPC, the Inter-Pressure Uterine Catheter. Totally did that wrong. The Intra-Uterine Pressure Catheter. Yeah, I think I did that right. Okay. But again, lots of acronyms. So those are two things. So that's my Tuesday Talks with the Green Bay doulas. Again, it's nothing to really be fearing about. It's something to empower you with knowledge and know that it may be something that happens for you, and that's okay. You now have the tools to be able to navigate your birth. Have a great day, everybody. Bye.